Very excited to be here to help do the ribbon cutting for the new ICU unit. It's a beautiful facilities here, and I'm going to turn this over to Doug here, Doug Brewer with the hospital.
Thanks very much. Thank you everybody for coming out. This is really an exciting day for us for obvious reasons. We have a beautiful new unit to present. Very exciting, really neat things about this unit. Not only did we expand and add an 8th ICU bed that will help us as we continue to take care of the region and the community, but something that's very rare, every room in this unit is negative pressure. So it really prepares us for future pandemics and just infection control in general. So we're really excited about that. So that's really great, but I'll tell you what's really neat. We have an announcement we're going to make today, and I'm going to turn the floor over to Dr. William Stigler from UAB. He heads up the tele-ICU program at UAB. Dr. Stigler.
So thank you for the invitation to come down. We're really excited. You know, we've been partnering, the UAB telemedicine program has been partnering with Whitfield since 2019 and have been really working alongside great doctors and nurses here to take care of the patients that y'all are responsible for. And so we see this as the natural evolution. The next step is what we're doing now internally at UAB is providing continuous 24/7 monitoring with critical care doctors and nurses in a tele-ICU system. And so we're really excited to announce that, that Whitfield will be our first external ICU that we'll be covering 24/7 with tele-ICU. It's the first ICU in the state that's not at UAB to have this coverage. And so what we've been doing so far has been great, and we've been able to help when the doctors and nurses have asked for our help. But this will really give us a chance to really be proactive and provide continuous care for the sickest patients who are at your hospital. And so really great to work with Doug and you guys, and excited about this partnership moving forward. So thank you.
Thank you, Dr. Stigler. That's really unbelievable for our community. Before we cut the ribbon, I'm going to talk just a little bit longer. I want to thank everybody that's back here and more. I see Freddie who's ducking on me, Jason, our board of directors, Charles, Allen, the city councilmen that are here, our mayor. I tell you, this hospital, it was much different a year and a half ago. And I tell you, without the support of these community leaders that are back here, we wouldn't be doing this today. I promise you that. So I really want to recognize you all and thank you all. As we cut the ribbon, if you haven't, you know, obviously you all know what an ICU is. It stands for Intensive Care Unit. And much of that care, as Dr. Stigler says, comes from nurses. You know, nurses are the lifeblood of an ICU unit. The sickest patients are here. Some of the best nurses. It's unbelievable to watch them. I stood over there in that corner one day and watched one of our ICU nurses working with a patient she was trying to wean from a ventilator. And I tell you, if you really want to understand what these nurses do, stand and watch them do something like that. They're amazing. It wouldn't be fitting for somebody like me to cut this ribbon. It really wouldn't be. It needs to be a nurse who knows what goes into this unit. So what I'd like to do is turn it over to one of our nurses. He's a 37-year employee here, started here as an LPN, has been an RN now for many, many years, has been the director of this unit for many years. He also happens to be our Assistant Chief Nursing Officer, Terry Elmore, if you don't mind.